there's been an evolution in our thinking among care providers and in the medical community about that very question. If we, assess people, let's say 15 or 20 years ago and ask them what screening tests should be offered, physicians and care providers would have always said the most accurate test possible. So if we look at colorectal cancer screening, it would have been colonoscopy. And what we've appreciated is that um, without taking into account the patient's preferences, that we're losing perspective on that compliance piece. And if we always overvalue the accuracy piece and don't consider the other aspects of the test, that results in fewer people doing the test. And so what happened really about 10 years or so ago, what we recognize is that in order to optimize compliance, patients need to have choices, and that the way you do that is to give patients a menu of options, as well as care providers. And that by doing that, you can improve compliance, because an adage is that if even the best test, even a test that's 100% sensitive and specific, is not going to work if it does not get used. And that's where I think the blood test really has this strength and is going to have an impact on colorectal cancer related deaths, because it's going to improve the compliance numbers and get us up from that 70-75% and hopefully up to maybe 80-85%. I'm not sure how much higher we can go over that. If when modeling is done, typically what we see is that there will always be about 10-15% of people who will not be compliant for a whole variety of reasons, and that even different screening test options being offered is not going to change that. There are a number of studies that are ongoing, trying to better understand how the test will perform in a real world setting. So one of the questions is one of the ones that we've just been talking about, which is what is the compliance with the blood-based test really going to be? Although everyone's anticipating that when the test gets ordered, that people will definitely be doing it, and that it will increase screening in that patient population, again, that 45 to 55-year-old population that doesn't have much access or much, to the word I'm looking for, doesn't frequently have healthcare encounters, whether they actually will get screened. And so that's one big area that's being looked at. Another one is whether people will be compliant with getting subsequent shield tests done. So they do it once, and do they actually get the second one done? And so that's going to be looked at. Another one's going to be when the test is a positive test result and the colonoscopy is negative, does that mean that they actually have another type of cancer present, and that's causing the positive test result? So, which is a really interesting question, and I think it's an important one based on the bioanalyte that's being analyzed in the blood, because the bioanalyte is tumor DNA, and the way the Shield test works is that the company has basically trained an algorithm that assesses DNA methylation and DNA fragment patterns that's specific for colorectal cancer, but tumor DNA from other cancer types sometimes can look similar to a colorectal cancer DNA signature. And so it may be that someone has an unsuspected breast cancer that causes a positive test result. Then they have a negative colonoscopy, and we won't know how often that happens until we have some more long-term follow-up data from people who are getting the Shield test being done. So I think those are some interesting questions that are being looked at. Another one's going to be, can the Shield test improve compliance in traditionally underserved populations and improve access to colorectal cancer screening? So that's currently being looked at as well. And then another one that I think is a little bit further down the line, but to me particularly exciting, is whether the Shield test can be incorporated into a multi-cancer detection test. So could you screen not only for colorectal cancer with this blood-based test, but also screen for other common cancers like breast cancer or cervical cancer in women? And that to me, I think, is really interesting. And those are directions that a lot of these companies like Guardant Health are going. Other companies working in this area, Freenome is one, Exact Sciences. One of the things that's really exciting about the Shield test is that this is the first blood test that uses this particular type of DNA technology that's assessing the circulating tumor DNA in the blood. And we're going to be seeing many other screening tests like this that will be rolling out over the next 5 to 10 years. There's already one that's from another company, Freenome, that's a colorectal cancer screening blood test that I think will probably get FDA approved in the next year or so. So we'll have two of these ctDNA based screening tests that are available. There are trials going on looking at the performance of these type of tests in lung cancer and breast cancer, liver cancer. So it's going to be really exciting to see what happens in the screening space with these blood tests over the next 5 to 10 years, and to see how they're used in the context of the current screening programs that are in place.